I am Dr. Upendra, Senior Consultant Urologist, KIMS Hospital, Secunderabad. Today we will discuss about the 5 common urological problems we face regularly. First one is the kidney stones. Number 2 is benign prostatic enlargement. Number 3 is urinary incontinence. Number 4, urinary infections. Number 5, sometimes we have tumors. It could be kidney tumor or any other urinary system tumors. So the first and commonmost is stones. So kidney stones are very common, particularly in this summer. The stones form very heavy. So these stones, when they form, they cause severe pain in the flank, radiating down into the abdomen, and that can cause vomitings, blood in the urine, and sometimes infection also can be there, like with high grade fever. So these are some of the symptoms of stones, and we have different types of stones, but the most common stone we see is calcium oxalate monohydrate stone, and sometimes uric acid is also there, and rarely infection stones do occur. So these stones can be treated by medical management and surgical management. Medical management includes increased fluid intake, some alpha blockers are there, some drugs which try to dissolve the stones, and coming to the surgical treatment, you have to go for laser therapies like ESWL, then we have RIRS, we have URSL, we have cystolithotripsy. So multiple procedures are there which treat these types of stones. So prevention of stones is very important, rather than, because once a stone, always a stone, because every year there is a 10% risk of recurrence of these stones. Coming to the second part, the commonest condition is benign prostatic enlargement. This is seen in males, particularly only in men beyond 40 to 45 years, and the main symptoms are nighttime urination. Number of times you get up. Normally we get up only once, but in this there will be frequent urination in the night, then in the daytime, then the patient cannot hold the urine, called urgency, intermittency, the flow goes down, and sometimes patient can have retention also. So these symptoms go in favor of benign prostatic enlargement, and we come to a diagnosis by doing ultrasound KUB, which can tell us how much prostate is there. And the other thing is, there is a test called Uroflow and Urodynamic study, which will give us whether the patient is obstructed or not. So once the patient is obstructed, these patients generally are managed by medical treatment with 80 to 85% respond to medical treatment, and they are alpha blockers and 5-alpha reductase inhibitors. And if the patient doesn't respond to this medications, then they go for surgery called HOLAP or HOLEP. This is a laser surgery using holmium laser. So these are the treatments for prostate. The third common thing is incontinence. This incontinence can be 3 types. One is urge incontinence, second one is stress incontinence, sometimes it can be mixed incontinence. So these incontinence occur most commonly in the females. So urine leak can occur in females. So first one is OAB, that's called overactive bladder, which can be because it can be idiopathic, that means there is no cause. Sometimes it can be because of sugar, that's called diabetic cystopathy. Sometimes it can be because of nervous system problems, so that's called neurogenic bladder. So these are some of the conditions where urine comes number of times and patient cannot hold the urine. So for this, behavioral therapy is very important, where we give them toilet training and some pelvic floor exercises there, they are important to do that. Second thing is, to confirm this overactive bladder, we do a test called urodynamic study. Second thing is stress urinary incontinence. This is common in females because of multiple childbirths. So for this, we try to give them pelvic floor exercises. If they don't respond, we go for surgery called TOT or TVT. And mixed incontinence can occur in these patients. So both have to be treated simultaneously. And finally, the other conditions like the tumors, like kidney tumor, bladder tumor, they have to be seriously managed, and if the patient is treated at stage 1 disease, then they get cure of all the tumors in the urinary tract.